Hello, my name is Kundlas and I'm a primary care physician in Central Florida, United States. Today I will be discussing about vitamin D deficiency. It is a very common problem. In the United States, about 42% of the population has vitamin D deficiency, which interferes and has very subtle symptoms, and most of the time it goes unrecognized. These statistics are a lot more worse for our Afro-American population and Hispanic population. Our Afro-American population has about 82% chances of being vitamin D deficient, and for Hispanics it's about 71%. The vitamin D is a very important in the body. It actually acts as a hormone and a vitamin. It is required for pretty much many chemical reactions in the body, including your bone, muscles, nerves, your mental health. Vitamin D is one of the only vitamins which could be manufactured by our skin when it's exposed to sun. And the requirement for sun exposure is very different for different populations. For our Caucasian population, they have very little melanin, and exposure to sun for 10 to 30 minutes will suffice daily to meet their vitamin D needs. Whereas for Afro-Americans and Hispanic population, where concentration of melanin in the skin is high, they require prolonged exposure, which is about 30 to 40 minutes. These days, life is very comfortable. We do not work outside, and we do have vitamin D deficiency as a byproduct of our lifestyle. As I mentioned earlier, vitamin D has very subtle symptoms. Those symptoms include fatigue, tiredness, bone pains, back pain, muscle weakness, muscle pain, hair loss, being depressed, delayed wound healing, and repeated infections, and also leading to difficulty in controlling blood sugar. Vitamin D acts at multiple chemical processes in the body. Now it has been implicated that it is involved in cell growth, cell division, and it plays more and more vital role which were poorly understood in the past. What we know so far about vitamin D, that it is very much involved in bone health. Your bone is made up of protein and calcium. Vitamin D is required to push calcium into the bones, and it does by absorbing vitamin D from your gastrointestinal tract and your kidneys. And it also regulates the level of calcium when it interacts with another hormone, which is called parathyroid hormone. Now let's discuss how we make vitamin D in our body. When we expose ourselves, especially our skin, to sun, the sun has two kinds of UV lights, UVA and UVB. UVB converts cholesterol under your skin into vitamin D2, which goes to the liver, where it gets converted into 25-hydroxy vitamin D under the effect of another enzyme in the liver. And from there, it goes to the kidneys, where it is transferred or changed into active form, which is vitamin D3, which is metabolically active and does all the actions which I just now mentioned. In addition to its role in bone health, it is required for cell proliferation. It is required for decreasing inflammation. It is required to boost up our immunity, and also it works with pancreas to make insulin work effectively and help us control sugar. Further, there are more studies going on, and we are finding a lot more role of vitamin D. Now let us discuss how we could find vitamin D level. This is a simple test. Most of the time your primary care will include in your yearly physical, and the levels which are critically low, below 30, are significantly important, because it's postulated and confirmed that people who run consistently low levels have high risk for increased morbidity and mortality, and they lead or have multiple complications. Further, how we could supplement or treat vitamin D deficiency. As I said, our life has changed. Life has become more and more comfortable. These days, we do not have to hunt and gather food in sun. Now, we could order all our caloric intake while pushing a button, which has led to that we are not having adequate sun exposure, so our skin is not able to make adequate amount of vitamin D. So the chief source which are left to supplement vitamin D are: number one, dietary intake in the form of dairy, green leafy vegetables and legumes, and also vitamin D supplements. Vitamin D supplements come in two forms, D2 and D3. D3 is a preferred way to supplement